Dr. Toomey, thank you for all you're doing for our state. Tell me how the reopening is going so far as it relates to cases and deaths from the virus.
Well, thank you so much for giving me this opportunity to talk about what we're doing and how we're doing it. We've been very optimistic at how the cases have unfolded over the last several weeks. We've had a slight uptick, which we will monitor very closely, but overall things have looked very good, and the number of deaths have gone down, and also I think of significance that hospitalizations have consistently gone down. And so what that's telling us is as we're testing, we're reaching out, we're identifying people early in the course of their infection and before they are very, very sick, and that's a very good thing.
Dr. Toomey, what do you think about these protests as far as impacting our ability to recover from this outbreak? You're not seeing social distancing in these demonstrations, and you're seeing people very close together.
Well, I would say not only about the protests, but also about some of the activities over Memorial Day, or even some of the graduation parties we heard about following some appropriately socially distanced graduations. Anytime you have people close together, not socially distancing, not wearing masks, not being careful and protecting themselves and others, you run the risk of spreading the virus. And because we know now that so many individuals, as many as 35% or more, may be totally asymptomatic, and the symptoms themselves are legion. There can be almost any medical symptom, from not just cough, fever, and the traditional symptoms we thought of, but also nausea, diarrhea, many of other things we wouldn't think of as a respiratory virus, that we have to be even more cautious. And so I would say, regardless of the situation, whether it's what we've been seeing, demonstrations with many, many people close together, or crowded people on the beach or on walking trails, I think we need to keep always in our mind that we are putting ourselves at risk if we don't take those precautions. Wear a mask, maintain social distancing, wash your hands frequently, think about when you go into a store or other area, make sure that you have a mask to protect not only yourself, but perhaps more importantly, those individuals who are providing you service. They are certainly the most at risk because they are exposed to the public coming in.
Yes, ma'am. What about when we see people coming here to take part in these demonstrations from other states? Should that be a concern, that perhaps they and their home states haven't been under as stringent guidelines as Georgia has? Should visitors concern us?
Well, I think any time, and again, it's not just for a demonstration, it's for any situation, whether people are coming here for something like we're experiencing now at this minute, or for tourism. People may be coming from areas of much higher risk than we are right now. Mm-hmm. And I think of my colleagues in New York City that have much higher case rates and are that anyone coming from New York would have, I think, a greater chance potentially of having been exposed to the virus. And so we should ensure that we give those individuals those same precautions we're giving to everyone else. Please wear a mask. Please social distance. Please respect what we are doing in Georgia to protect our citizens here, to protect ourselves, to protect our state. We've done a good job of flattening the curve. Please help us as a visitor to join with us in protecting our communities, our citizens, our state from the spread of the virus.
Do you think that we have all the equipment and testing tools that we need now? Are our stockpiles where they need to be?
I think we've really done an incredible job of getting additional testing equipment, getting those additional swabs, getting additional capacity, not just with our own lab, but also with the CDC lab. CDC has agreed to do as many as 750 tests a day for us. Our own lab has ramped up to 2,500 tests a day. And I don't know if you remember when we had our first meetings early in the course of this pandemic, we could only do about 50 tests a day. So we have really ramped those up. We have contracts with private labs as well that have been able to increase their ability to turn tests around very quickly. Because we did have some problems, and I'll be the first to admit that, with slow turnaround from some of the commercial laboratories. That seems to have been resolved. So I feel very good about the fact that we have testing capacity, and I urge everyone to get a test if you have any concerns whatsoever. I think the more Georgians that we can test, the more we'll be able to get the message out. And when we find individuals who are infected, whether symptomatic or asymptomatic, we can quickly initiate contact tracing to stop further spread in the community. I also wanted, if I have one more minute or 30 seconds, to talk about the fact that we are not just monitoring absolute number of cases, which I think gives a partial picture of what is happening, but we actually look at hotspots emerging. And that may not be evident on the graphs that you see on the website, but we can look at that and then quickly intervene, get with our local health departments and ensure we go in and understand where those increases have come from, whether from testing in a nursing home or some other long-term care facility, or whether from some other action like a party that with a large gathering of people.
Right.
And as we learn more about this situation, we will be better about being able to offer people guidance about moving forward in the days ahead.
Well, Dr. Toomey, as I expected, our time has absolutely flown by. We need to dedicate an entire 30-minute broadcast to a conversation with you, but I do appreciate you enlightening us and informing us in these few moments together. Thank you for that.
Anytime. Thanks so much.
Absolutely. Dr. Kathleen Toomey, Commissioner of Georgia's Public Health Department.